Now, if somebody has migraines, there's good treatment for the migraine headache, and there's good treatment to prevent the headaches.
Yes.
And there's a lot of information on lifestyle.
Yes.
Take off. Tell me how you treat migraines.
Well, first of all, you make the diagnosis that it's migraine. And then from the history, you're trying to find what are the triggers? Are they aware of the triggers? Since it's more common in women, we certainly know that at the time of the menses, the migraines are much more common. We know that stress can make it worse. We know that certain foods can make it worse. We know that any change in their lifestyle makes it worse. So the worst thing on a weekend, when you've been busy all week, what do you want to do Saturday morning? Sleep in. For a migraineur, that can be a trigger for a migraine. So any of a change in diet, activity, doing things, maybe alcohol, can trigger migraines. And migraine has a terrible burden of disease of how it affects the individual. So we go through that story first to see what can you modify, what can you change, what can you identify.
Does the patient usually recognize that maybe alcohol does that, or sleeping in does that, or you bring it out when you're taking the history?
Some of it does, but a lot of it you kind of bring out, and then when you mention it, then you listen to what the patient says. But I've always been curious, if I have to mention it and the patient says, oh yeah, I'm wondering how much I'm being suggestive.
Sure.
But it's just something you let them know.